Sometimes when you're doing point-of-care ultrasound procedures, you can run into trouble very, very quickly if you don't follow a couple simple rules, because essentially every procedure is similar. They're similar in the fact that you need the room to be set up so that your line of vision goes through the site where you're performing the procedure and directly to the screen. If you have the screen off to either side or behind you and you're turning and moving, you're going to very quickly kind of get flustered and you're going to do something that you don't want to do. Or you're just going to kind of lose your needle if you're doing a needle-guided procedure. So make sure that your line of vision is straight. The second thing, and probably the most important thing, is making sure that when you use the transducer to find the image of the site where you're performing the procedure, that doesn't move. Once that transducer is in place and you have the image you want, you don't want it to move. And anchoring that hand effectively is often the difference between someone who does procedures, really, really well and someone that struggles. So remember to set up your room well so your line of sight is always at the site of the procedure and at the screen so that you're not moving, and make sure once you find the view on the screen that you want, that anchor hand stays anchored and doesn't move. And I think if you do those two things, you're going to have a lot of success with all of your point-of-care ultrasound procedures.